In acute stroke care, faster treatment directly leads to better patient outcomes. This team-based stroke algorithm helps to deliver thrombolysis as fast and safely as possible to rapidly evaluate patient eligibility for a thrombectomy.
Since the effect of acute stroke therapies is highly time-dependent, every minute counts. Therefore, strategies are needed to shorten the time to treatment without putting the patient's safety at risk.
The combination of a team-based algorithm and regular training with the entire interdisciplinary team shortened the time to treatment in our center.
We developed this algorithm when we noted that a large share of fatal errors were not due to a lack of knowledge, but due to deficits in communication, interaction and decision-making.
Acute stroke is a high-fidelity situation which requires dedicated teamwork, clear communication, cooperation, decision-making and management of stress.
Our composite intervention focuses on the importance of interdisciplinary teamwork, and it's easily transferable to other hospital settings.
Joining us in this demonstration will be Arne Lauer, a neuroradiology resident, and Tanja Hölzinger, a radiology technician.
When the alarm is heard, the ED nurse goes directly to the computer to check the information on the incoming patient. Hypothetically, the system announces a male patient with the tentative diagnosis of a stroke within at least 6 hours, arriving soon by ambulance. When the paramedics enter the ED with a patient on a stretcher, they immediately report to the stroke nurse and SU resident. Next, the resident performs an initial check that includes the FAST test.